Welcome to another episode of the Flatlander Fit Podcast. I am your host, Jason Schultz. And what I had mentioned in the last podcast, that I would be back with a back pain part 2, the real story, meaning that this is what I've actually been going through. Some back history on me. I've dealt with back pain for about the last 30 years. It's been off and on. I've had chiropractic treatment, and then I've just kind of rehabbed myself. And that's kind of what I had to do today, or over the last couple of months, essentially. With that being said, we kind of touched on a few things with Dr. Luke a couple episodes ago. And one of the most important things that came up was keeping people moving. And that's going to come into play, and I'll explain that in a little bit. However, I injured my back in about the end of December. And instead of giving it the attention that I should, as a therapist, I decided to be a normal guy and I'm just going to work through it and blah, blah, blah. And so that's me not knowing better. And the difference is that a lot of times I need to make sure I take my own advice when it comes to things. So with that being said, when I realized that the things I was doing was not going to help, a lot of times I can work through a flare up. And I guess I didn't really I didn't understand the severity of the flare up until by backing off on someone by bigger movements, and through like that. And it was not fixing stuff. A lot of times it would just kind of work through, keep up the strength. We can really eliminate a lot of back pain through strengthening. I'm pretty consistent at working out. It's a goal of mine because it keeps me doing, or hopefully being able to do, the things that I want to do. So I had to really kind of take a step back, and I had to assess myself. I've never had an MRI. I don't plan to unless there's certain symptoms that prolong. Then I know that there's something that I really need to take a look at, which would then look at other different modes of treatment, hopefully avoiding surgery. That's everybody's thing, because it never is the same afterwards. So now I'm gonna have to look back at all the years of treating neck and back patients, and now I become a patient myself again. It's been a long time since I've had a flare up this bad. What I had to do, or what I decided to do with what I was realizing was symptoms, was that let's backtrack a second. So like some of my symptoms were pain when I go to transition from sitting to standing. I would have some pain in my leg. I'd have some pain in my foot. But the things that kind of kept me from going in to see a doctor, just because I kind of understand and I know the process on that, I would suggest if anybody has these symptoms, definitely go see a medical professional, because you definitely want somebody to help guide you through that. It might not mean surgery or something like that, but you can, get to a doctor, get in to see a therapist, physical therapist, and really start working on some different exercises that can make a big difference when it comes to treating that back pain. So with that being said, I'd have some nerve stuff into my leg, or thought was nerves. It could be muscle. There was some tightness. So now I'm looking at how am I going to evaluate myself. So what I started doing was backing off on weight. However, as Dr. Luke and I talked about, and we preach this to all of our patients, is you want to keep moving, because the natural reaction is to stop moving. When we stop moving, we start getting weaker. When we start getting weaker, pain amplifies at that point. And going through the whole pain thing is a whole nother probably 10 podcasts if we want to really get down to it. But with that being said, movement is key. Staying strong is key. So what I had to do was evaluate where I need to back down. So what I ended up doing was not adding, I took away my bigger lifts. However, that means squats, deadlifts, those types of things for right now. I went to body weight squats. I went to reverse lunges. So I'm hitting quads and glutes, hamstrings and glutes. I want to make sure that I am keeping up with leg and glute strength. It's imperative to bending, lifting, moving. And guess what we do every day? We bend and we squat and we lift and we reach below the waist for, sometimes it's your job, Sometimes it's for taking care of the family. Sometimes it's just daily tasks. Either way, those are things we need to do. We need to not be afraid to do that. So I needed to keep myself moving both mentally and physically. And at the same time, as much as extra weight is helpful for strength, you can maintain a lot by doing those types of movements for the lower body. I then started to incorporate small increments of core strengthening. I focus on lower abs, very gentle. So I'm backtracking a lot from where I was at. But at the same time, as I'm doing it at a lower level, I am noticing that I am starting to feel a little bit better. Planks were key. I wanted to keep up with upper body. So I went to machines, which was great. So chest press, you know, rows, arms, all that kind of stuff. Because sometimes when we tighten our core, when we're dealing with back pain, sometimes it's going to aggravate a little bit. It's got to, that tissue has to calm down. Ice, a little bit of ibuprofen was helpful. I changed how I slept. Started using, I would say, or what some would say, just better sleeping hygiene at that point. I use a pillow between the knees. If I was rolling on my side, I could only sleep on one side for a little bit. Pillow under my legs. If I was on my back, it would take that pressure off. So when I would wake up in the morning, I would hope that I wouldn't be as in pain. And that's usually the worst for a lot of us. We get up because we have now been in one position for a very long period of time. So we end up being stiff. And with tight muscles, that can aggravate a lot of those things. With that being said, it's also about being patient. Almost any study you find out there with back strain, back injuries, if you give it the time, it can resolve on its own by doing conservative care. And that's what I did. So yeah, I'm looking at coming into probably month 3, but where I was almost challenged to sit or stand or get up in the morning to move, I am now able to get up every morning. I am stiff for maybe about 10 minutes, do a couple stretches. I'm able to take care of morning chores, take care of the dog. I go to work. I'm able to work all day. I demonstrate lifting. I demonstrate squatting. I demonstrate deadlifts. I demonstrate all those types of things. So this little regimen has walked me through it. And I'll tell you what, I was no different than any patient that comes into my clinic. And this is one of the nice things when it comes to helping me program clients, is that if there's any history of these types of things, I already know that workaround. I already have a plan in place. I have a couple of ideas. We're going to start out. So we are always going to make sure that you get to a certain point of function and hopefully reaching that goals. But with that being said, I had to use that regimen every day. Then the thing that ended up helping me the most, and there's a lot of positives and negatives or pros and cons as people want to look at, like with soft tissue work. So I believe soft tissue work at the right time can be helpful in obviously managing that tissue, but at the same time, it's not a reliance. So a massage is not going to fix your back pain. It can help loosen up the muscles to allow you to do the muscles to get stronger. You know, pick whatever else you want to use for that. So for me, I have a membership and I train some clients at Planet Fitness. So I took advantage of their hydro bed. And within probably 2 sessions of that, I was able to loosen up things that I couldn't get to as well from stretching. And then that became the next level. All of a sudden now I'm sleeping better. That goes back to the last podcast, improving sleep for overall recovery, muscle recovery, immune system, all those types of things. That allowed me to work out harder. Now I'm able to step up my intensity. I returned to light deadlifts, some RDLs, great for the lower back. Able to change up my plank to toes, back to doing push-ups, which is also part of the plank. I could do that with no pain. I break them down into multiple sets, but I also get to quite a bit on there. I was able to then start incorporating more dumbbell work. So overhead work, out front work, not having any compression on the spine, feeling pretty good there. That was a game changer with keeping the tissue loosened up. So that is part of my regimen. And I was doing that daily because I had the option. It's only 15 minutes from, not even 15 minutes, like 5 minutes from my house. And then over the last couple of weeks now, I want to back up. So as that started happening over the last 2 weeks now, I have not been taking any ibuprofen at all. Not that I took a lot to begin with, but I've eliminated that. I've now been to the point of strengthening that I don't go to the hydro table or the hydro massage chair every day. I'm now maybe 3 times a week because I am now stronger. I am able to sit for longer periods of times. I am able to stand and not be bothered. I am able to lift heavier things. I'm able to push heavier things, to do things around the house, which is super important because we are coming into spring here in Minnesota, and I need to be able to get patio furniture out. I need to move stuff around the garage. Super important. And then, of course, for me, being able to get out in the outdoors with my friends and family. So, one of the things that I want people to take away that are listening with back pain is that please keep moving. That is the most important thing. Do not shy away from soft tissue work. However, it is not the answer or the fix all. So use it to help you get back to better strengthening. Another hugely important part is functioning is that strengthening. The other thing, do not shy away from big movements. You can do them with body weight. The nice thing we'll say with squats is you can do a quarter squat, you can do a half squat, you can do a full squat. All those are essentially the word functional, and that does help us keep moving because we need to have that confidence to do our normal movements at that point. So it's good for our brain. It's also good for the body. It's also good to help with regulating pain. Speaking of pain, finding a mode of cardiovascular training is super beneficial for helping our mind regulate pain, which is why I was able to walk. I wasn't able to walk at the higher incline that I like to do. However, I was able to do duration. So I'd have a smaller incline, able to do it for longer periods of time. It helps with pain regulation in the body. Another important part of my recovery when it comes to that. Doing those 3 types of things, huge. The other thing, anything that's persistent with symptoms or you have any concerns about, do not hesitate at reaching out to a medical professional to get another opinion. Remember, you can see these physicians if they're offering up a procedure or anything like that. Now, you don't have to do that, but it's good to have that information because they will probably do some sort of diagnostics, or they should do some sort of diagnostics testing with you to give you some information. You can get in a second opinion, have it in your back pocket. If things are really bad, you've already now taken the first steps, and maybe that might be the course that you need to do. But I want to say is that being patient and the things that I'd mentioned a little bit a few minutes ago or a minute ago can really help you with managing and working through back pain. The other thing with it that goes back to my conversation with Dr. Luke is that I did not stop working out. That's the thing. No matter what, no matter how bad things got, I did not miss a week of workouts. Now, with that being said, I may have taken extra days. So I might have had a couple of weeks where I might have only worked out twice. That was cardio, a little bit of upper body, and obviously, like I'd mentioned before, doing some lower body stuff with squats. But I did not miss working out because really that's like I need that mentally because of what it does to help with pain regulation. I also need to do that to keep my confidence with moving. So despite having some pain, as the muscle starts working up through the workout, as I come home, I do have some time now to do the things that I need to do and move a little bit more because my body is warmed up. It is feeling loose, and a lot of those symptoms were not as persistent or bothersome. So going forward, we are now moving into the next phase. I'm actually back to now hip sled. So now I have extra resistance for the legs. I am now doing heavier overhead press in a hammer strength machine for shoulders. So I don't have as much compression coming down, but I'm still able to work the shoulders a little bit more. Weights up now, arm work, able to do more for the back, and incorporating dumbbells in regards to like reverse lunges. So I mean, it's not very much. It's 8, maybe 10 pounds, depending on how I'm feeling, but I'm now back up to that resistance. And here's the most important thing is that I am not having any of those extra symptoms that come out. Even the next day when I wake up, changing my sleep hygiene of what I mentioned before. I don't have that stiffness in the morning. I'm not in that. I doesn't increase stuff because my muscles aren't that much tighter because of doing things to help keep them loosened up. So, back pain, do not let it stop you. There are ways around it. There are people to help you. Feel free to reach out to me. I would love to be able to help you or even just listen if you have some questions or concern because things that you're sharing, I would definitely be able to maybe help you which professional to talk to, um, get the right diagnosis code, and then take the next steps forward, whether it be physical therapy, something you could transition to. If you wanted to work with me, we can work out with something, but making sure that you have that taken care of beforehand. And those are things that I ask clients anyways. I want to know that health history. So there's things that we need to work around and be aware of in order to get the best program for you. Um, Again, I did not see anybody, but that's my profession. The other thing is that because of my profession, any type of symptom, I'm able to converse with my colleagues, and that includes PM&R doctors, pain management and procedural doctors, as well as a fantastic team of physical and occupational therapists. And so essentially, even though I didn't see anybody officially, unofficially, I did have guidance through that. And a lot of times it was me just checking in. I'm like, this is what I'm kind of noticing, and this is kind of my course. And most people were, or most of my colleagues, I would say, well, all of them were like, yeah, it kind of makes sense. But we all know that things that we need to watch out for. So, um, the big thing is essentially do not quit moving. If things are persistent, make sure you see a medical professional and get the right diagnosis. You don't want to let things go too long, which again is why I have a very short window of what I had for symptoms that if they progressed after X amount of days, I already knew what the next step was going to be. And essentially, by you seeing a professional, you want to have that first step in place, establishing that there's something going on. And then we watch the symptoms and go from there. So that is the real story on back pain and getting back to things. If you have a history, more than likely it will flare up. I've got a long history. I train, but I'm no different. Things will flare up. Even trying to be cognizant at times, I might not give the attention to that I should for certain body parts. And it reminds me that I need to make sure always things are complete. Now, you can do a complete workout and hit the things you need to do with minimal movements too. It's just making sure we have the right ones to do that. So, with that being said, get outside, be active. Do not let back pain stop you from working out or doing your things. There are a lot of people that are here to help you, and the benefits of working out and staying active are unbelievable for us to live our best lives. Have a great day. We'll see you next time.